Hello everybody, my name is Dr. Masumi. I'm radiologist and as you know, I'm starting to present some of experiences of interested in experiences of CT and MR images and you can help me in better diagnosis. These cases may be challenging, but lots of them have proven by surgical and pathologic sampling, but some cases are really challenging and you may have another diagnosis for them. The first case, as I shown here, is a patient referred to our hospital for respiratory distress and dyspnea and axial images of a long window of patient demonstrate a thin wall cyst here about measured 15 millimeter in its size, and in the next images the thin wall cyst could be continued to the other cuts and here, but the cystic structure have special additional abnormality and you notice that the vessel is passed through the cyst. A large vessel is passed through the cyst is more detectable here. The diameter of the vessel here is obviously uh, different with other vascular diameters, and in the mediastinal window again this vessel could be slightly prominent than other vessel, and my diagnosis was Rasmussen aneurysm. But in differential diagnosis, two other diseases such as Behçet disease and mycotic aneurysms should be considered. About Rasmus aneurysm, as you know, it's a cavitary lesion of TB, which has a vessel passed through the cyst. The Rasmussen aneurysm is a pseudoaneurysm of pulmonary branch through a cystic lesion, a thin wall cyst, or maybe old cavitary lesion of TB. But unfortunately, our patient didn't have any history of TB. It could also be a type of vasculitis such as Behçet disease. As you know, Behçet disease is a disease more common in Mediterranean population and is more common in the male than female. Its distribution through the lung is predominant involvement of pulmonary vessels. And the other third diagnosis is mycotic aneurysm, which is infection of wall of an artery by inflammatory and infectious process. But if you have any other diagnosis for these pictures of this cyst and this specific picture, you could put your diagnosis in the comments and help me to thank you for your suggestions. The next case is a case again about lung disease. As you know, there is another case of CT images of a lung of a patient with respiratory symptoms, and here, as you know, and is obvious, there is loss of volume of left lung here, loss of volume of left lung with a combination of some fibrotic changes and traction bronchiectasis, includes cystic and tubular pattern of bronchiectasis with loss of volume. In the other images here, you also notice that cardiomediastinal shift to the left side and to the decreased lung volume is seen, but the point of interest for me was trans midline cross section of midline migration of right lung parenchyma through the left side. Also, it has extended to the anterolateral aspect of the cardiomediastinal structures, and in other cuts, you can see this finding too. This picture mimics somewhat shape of liver in the cuts of abdominopelvic CT scan, but here a lung is passed through the midline without distinct differences between right and left side, and here just really the right line is extended toward the left side, and it seems to be compensatory enlarge of the right lung. And this is a case of lung midline cross section, and I think it's a variation in the shape of lung. But as you know, two other terms of lung shape are horseshoe lung, which is a congenital finding, and we are expected to see it in the pediatric age group or in low age groups, which is demonstrated by midline migration of the lung, but posteriorly from the right to the left side, and is not proper for this diagnosis, for this normal variation that I shown here. And the other term may be keep in our mind is compensatory lung growth, which is another term, and I don't enter to it. The next case I would show here is a case of wrist pain, and as you know, an MRI image, coronal T1 image of patient is available. Here you can see normal bone marrow density of bony structures, especially carpal and the distal radio ulnar bony structures, but an abnormal finding is low signal intensity of the smallest bone of one of 8 carpal bones, which is lunate bone, and in the other images, which is fat SAT, there is no obvious changes between bony structures, and in sagittal images again some inflammatory changes here could be identified, and finally in PDFS images, which is more helpful for us, is loss of signal intensity of the lunate here, and as you know, the disease is known as lunate osteonecrosis, which is a type of osteonecrosis of the carpal bones, and when blood supply of the lunate bone is involved, secondary disease the disease will develop is known as Kienbach disease or lunate osteonecrosis. Thank you guys for sticking with me, and hope you have a wonderful day, and put your suggestion down in the comment here, and see you in the next session. Thank you so much.